impulse again is generated here. This time the length of the pathway is normal, conduction is normal. This time the length of the pathway is longer. LNGTH, length of pathway. Its pathway is normal. The length of the pathway is longer. When this time the length of the pathway is longer, again we stimulate this strip at the 12 o'clock positions. This is here is the synode, and the synode is produced after 1.2 seconds, one electrical impulse. In this area, the place of stimulation is normal. After 1.2 seconds, one electrical impulse produced. Velocity is normal, conduction normal, but the length of the pathway is longer. Right now, once this area is stimulated, this electrical impulse is started to come here. Since it takes more time, more than 1.2 seconds, and finally it reaches here in this area. When reached here, this length of the pathway is longer, it takes more time. By the passing of the time, finally it reached to the first time. When it come here, this originally stimulated area at that time become out of the refractive period. And this electrical impulse right now enters to the circle. And this electrical impulse travels around and around of the cycles. And this electrical impulse travels again and again of the arterial, again and again around of this cycle. It is not stopping unless Tircha. Did you catch a little? Okay. The second experience. In this second experience, this time, this was a normal condition. This was abnormal. Just there, the length of the pathway is longer. Right now, in this another things. The most common case of this pathway is repeated. These people who have developed, these people who have got dilated heart. Dilated heart, this strip is also longer. Right now we come to this. This time the length of the pathway is constant. Constant. The length of the pathway is constant. This is again the first time, say node, or 12 o'clock position, and 1.2 seconds. This time the length of the pathway is normal, but the velocity is decreased. This time the length of the pathway is constant, but the velocity is decreased. For example, there is some block, especially Purkinje fiber blocks, or the second thing, hyperkalemia, and finally in cases of ischemia. In this condition, the speed or the velocity is decreased, but the length of the pathway is constant. This is also when to reach started from when this electrical impulse moves slowly because of this slow velocity. Why the patient develop slow velocity? Because there is a lot of thing which does not allow for the electrical impulse to reach to this area on time after 1.2 seconds. So it also takes more time. When it reaches here, this original area become out of the refractive period. And this electrical impulse enters here, and finally it travels again and again around the cycle, or travels around and around of the cycle. It is not stopping until you do not start any treatment. Did you catch? The last one. We discussed this part so many times with you. This time what will happen? This time the length is constant, the speed is constant, but the refractive period is very short. For example, here we want to stimulate this area. When you stimulate this electrical impulse, come here, come come here, and this is the short refractive period. When it comes here, this electrical impulse, understand that originally stimulated area is out of the refractive period. So it is also entered to the cycle, and this electrical impulse travels again and again around the cycle, or travels again around the cycle. If there is no treatment, it does not stop. The most common cause of this factor especially norepinephrine or some catecholamine, which have got the duration of half-life of this catecholamine or norepinephrine is less. So this area become out of the refractive period soon, and this electrical impulse again enters, and they reach very soon is here, and they understand that there is no in refractive period, so they moves around and around of the cycle, around and again around the cycle. Unless left this case left untreated, they may continue. Who should understand more or less?